name is Robbie Omondi, and this is Life 360.
Ladies, have you ever wished you could just pause your period? Maybe for a vacation, a wedding, or an important event? Well, it turns out that science makes it possible. But how safe is it really to delay your period using pills? Today we sit down with Dr. Naila Farouqi to break it all down: what works, what doesn't, and what every woman should know before trying it.
So regarding the pills, it depends if somebody is already on a hormonal method. For some people, they're already using the oral contraceptive pills. So what happens is, in a pack of pills, we normally have 21 pills that are hormonal, and then the rest of the 7 are a placebo pill. So if they desire to maybe delay their periods by another 1 month, once they finish those 21 pills that are hormonal, they actually start the next packet by skipping the 7 days. And this is for people who are maybe already using a hormonal method of pills. Then there are those who are not using any pills, or maybe who are not on any form of family planning, and they desire to push their periods for a bit. So mid-cycle, if they decide earlier on, then they can start a fresh a packet of oral contraceptive pills. That's the combined oral contraceptive pills, anytime, maybe a week before their scheduled periods. But the thing with this is, we actually advocate for pills to start on the first day of the menses. So if your periods are starting today and you are using the oral contraceptive pills as a contraceptive method, it's ideal to start them on the first day of the period. But then now again, we're discussing the women who want to delay their menses. So once they start this packet, they can use it for the 21 days and then stop it thereafter. They'll have delayed their periods. Another way is, there is norethistérone. It's a type of a progesterone. For this, you can use it almost last minute, just a bit 2 to 3 days before the periods are meant to come, and then they use them for 20 days. However, when used in this manner, it doesn't work as a contraceptive method. It's just to delay the periods. So they need to use an additional contraceptive method if they were planning on maybe not conceiving during that time. Yeah, so the mechanism, how they work, is basically they interfere with the cycle in terms of the cervical area and also the lining of the endometrium. They interfere with the hypothalamo-pituitary axis. So what that means is, the brain normally makes hormones, and use of these pills, because they are hormonal, they do not allow the pituitary gland to form particular hormones. So your ovary, as a result, either does not make follicles that are ready to release the egg, or it just does not release the egg. Also, the mucus around the cervix becomes quite thick, so the sperm is not able to penetrate and then meet the egg eventually. So yes, there are, obviously everything has side effects. You can't be 100% in everything. So in terms of these pills, not everybody is qualified to use them, as in there are some contraindications to the pills. Or if a person has a history of clots in the body, then it's not very advisable to use the combined oral contraceptive pills. For women who are breastfeeding and very early on, some people, while breastfeeding, may not get their periods, but others who have started their periods early on, before 6 months, combined pills are not to be used because they interfere with the milk supply. Then, as with every other medicine, there is nausea, sometimes acne, breast tenderness. Yeah, these are the common side effects associated with the hormonal pills. So if a person is already using the combined oral contraceptive pills, and then like for after the 21 days they decide to use the second pack, that's how much they should limit themselves to, not that they keep on using it for pack 3, pack 4, no. And then in terms of as an expert advice on use of this, so ideally your body is natural. When you decide to delay the menses, remember you're interfering with the natural process. So if your cycle has been a 28-day cycle, it's coming maybe on the 1st of every month, you've pushed it, remember now the cycle has to kind of restart itself. So generally, no, it's not advisable. But then again, we're in an era where I understand people need to use it for different reasons. So you can use it maybe the once and maybe the 2 times, but not for over long that you're keeping on doing it, because eventually you'll mess up your whole hormonal system. You'll break out with acne all over, and have this breast tenderness that's coming, expose yourself to high risk of getting clots within the body. So definitely it's not advisable to use over a long period of time. Definitely, I feel like there should be regulations in the same, because even if it's a youngster who is, maybe sexually active, we're not denying them the use of these pills as a family planning method. But if you come to a doctor, they can explain to you, talk to you about the advantages, disadvantages, maybe the side effects, what suits the body. Because for like a person who's hypertensive, there's some particular modes of family planning that cannot be used. And you as a layman, maybe you don't know which medication that is. You go to over the counter, buy them, and hence expose yourself to other side effects. So where here in Kenya you can get them over the counter, but I understand abroad they're a prescribed medication. Yeah. Life 360.